Добрий день, розпочинаємо роботу.
Good morning. We start our working day at Ukraine Crisis Media Center, and the first topic today is accessible, affordable medicines program status, and our speaker is Roman Ilyk, Deputy Minister of Healthcare of Ukraine. Good afternoon, dear friends. I will be brief and I will tell you about the status of the program, what is happening in the scope of affordable medicine program, which is a governmental nationwide program. The first thing I would like to mention, medicines for three groups of diseases, cardiovascular diseases, asthma and type 2 diabetes can be received regardless of age by any patient in Ukraine. On voluntary basis, almost 6,000 pharmacies joined the program. This is almost every third pharmacy of Ukraine, taking into account that among pharmacies which are in communal ownership, only 1,000 of pharmacies are in communal ownership. So we would like to thank all participants of the project who joined it on voluntary basis, and also we invite other participants, other pharmacies to join the project. 67 million hryvnias is a figure saying about the total amount spent for recent 2 months. For the period of the program 2017, $500 million hryvnias are apportioned by the government. We have positive dynamics characterizing that the funds apportioned for the program are sufficient. Only 13.5% of disbursements have already been allocated. 2 million prescriptions have been issued to our patients in these three nosologies, and 1,500,000 prescriptions in fact have already been used by the patient. This means that more than 1 million of citizens of Ukraine have already used the program. I would like to tell about the dynamics of our program broken down by regions. We know that in any large-scale project which are nationwide, there are leaders and outsiders who are behind them. Among leaders in Ukraine, I would like to mention Vinnytsia, Lviv region, Dnipropetrovsk, Ivano-Frankivsk and Kharkiv regions. The stable dynamics demonstrated by Volyn, Zhytomyr, Ternopil and Cherkasy are rather active in the program. In May were Kiev region and Kherson city, and negative dynamics is observed in such regions as Chernivtsi, Mykolaiv and Lugansk. These are the indicators which concern increment of pharmacies joining the project. The situation is being under constant monitoring of the Ministry of Healthcare, and the increase in the number of pharmacies is one of the indicators in the regions which we evaluate. Use of funds. Vinnytsia, Kirovograd, Chernigiv, Kharkiv, and Ternopil are leaders in using the funds. Khmelnytsk and Poltava stable. Outsiders are Donetsk, Zaparpattia, and Sumy regions. I would like to use this chance and say that if the situation in the region differs in its different areas inside the region, then on the level of regional municipalities, the funds may be reallocated to the areas of the region which leads. In September, as usual, the funds from those unsuccessful regions will be withdrawn, and they will be transferred to the successful region. So 13.5% of disbursements have been allocated already. Budget resolutions for reimbursements for affordable drugs, the government gives 500,000 hryvnias according to the budget resolution. So in this health care direction of reforms, in this healthcare area of reform, the state will be moving forward supporting the patients who needs affordable medicines. The cash check average for Ukrainian patient costs 35 hryvnias. There are problems related to the implementation of the project. They are related to the lack of e-health product. For the program to be successful and for its dynamic development, we need a register of institutions, register of patients, and register of doctors. And the Ministry of Health has been putting lots of efforts, efficient efforts into this. And by the end of the year, we're supposed to have the registers, and the electronic prescriptions then can be issued, and this would help us to resolve the problems which I'm going to mention. The first problem is the clear register of patients which will provide the opportunity to monitor the funds, and then also the possibility then will be provided for getting medicines by patients in any location around the country. Now patients can get medicines, can buy them only in pharmacies located at the place of their residence. The project addresses chronic patients who are required to pay a lot from their pockets for medicines, and there are some medicines, at least 3 of them, where pharmaceutical manufacturers do not produce enough drugs. At the same time, the Ministry of Health keep in contact with these pharmaceutical manufacturers, and our work group works on developing the competitive mechanism which will provide for all medicines availability on the market. Some medicines can be bought with just small portion additional payment. The prescription is issued, and pharmacy staff can consult the patient what medicines are free of charge and what medicines can be bought for a small portion of their price. Limit prices will be set from August in the States, so we wait from August new participants to join the project. Now we have 37 pharmaceuticals inside the project, including 2 international manufacturers, and the scope of medicines will also be expanded, and this would provide better access to medicines required by the patients. 200 million hryvnias could also be added to the prescribed financing, and the program then may be expanded by specific nosologies which can be added to bronchial asthma, cardiovascular, and type 2 diabetes. What categories of diseases will be added? This we will discuss at our other meeting, because we have already addressed our expert committee with the ministry, and we wait for the proposals from the expert committee so that patients the new nosologies which will be added to the project at its expansion stage. This new added medicines will provide reimbursable drugs to patients suffering other diseases. The number of patients visiting doctors have tripled. This addresses the issue of self-treatment and no visits to the doctors, and this is the issue which is addressed by the reform of healthcare system in general, so that more patients, most of them are treated in outpatient clinics, and the medicines which are in the national register and recommended by WHO, their use has increased 2.5-fold. Ukraine needs medicines which are high quality and recommended by WHO, and they are on our register. The third component is the decrease of average weighted package of medicines. The 90% of cost, the 90% of cost of packaging of the drugs have been eliminated. This means that the cost of medicines now are halved. That's all in brief. If you have questions, please, you can ask. I would like only to add that this program is patient-focused, and it is focused on chronic patients. This is an unreliable component of the general reform being implemented by the Ministry of Healthcare of Ukraine, and we have big hopes. We place big hopes on today's draft law 6127, which is being on the agenda of the Verkhovna Rada today, and we hope it would be voted for today, and in the budget of 2018 then all amendments to the funding system of healthcare system which would allow its total transformation. having the budget as already have been allocated and will be allocated and announced in the scope of 25 billion hryvnias. This money will help to improve health of every citizen in Ukraine, and there are fundamental basic pillars which won't be changed. Reimbursement will be at the level of ambulances, outpatient clinics, and these medicines are for patients, for chronic patients. Reimbursement will be against prescriptions to be issued by doctors by active substances. Reimbursement will be against prices of the least cost medicines. This would help to decrease the prices on the market and setting fair prices which will be at comparable level with Poland, Czech Republic, Slovakia. If the manufacturers are ready to sell medicines at these prices in those countries, this means that they can sell it at the same price in Ukraine. You told that from 1st July the prices will be lower. Some additional drugs will be added to the registered, or the limit will be lowered, the limit price will be lowered in the register. Everything which concerns reforms looks like the following: 21 active substances, so-called INNs. The reference prices for 5 countries, neighbors of Ukraine, will be checked, and the average price between these 5 countries for these 21 active substances will be calculated, and then applications will be submitted by pharmaceutical companies, and we lead them in the rating, and then we see what price is the lowest, and we fix all the additional payments for other medicines with the same active substance. So the limit is set, and everything which is within the limit is published. In parallel with affordable medicine program, the regulation 1303 is in force. It provides the opportunity to get medicines free of charge, which are reimbursed, which prices are reimbursed from local authorities' budgets. But then the prescription should be issued by the doctor based on this regulation 1303. Data are will be published when the new rules in the program will be added, the new nosologies which will appear inside the project, in the scope of the project. I will not name them now, but such priority diseases number 15 in Ukraine. So there are nosologies which require our focus, more support, more funding from the state, and in this portion of their costs which are not covered by the state program so far. So we will tell our population these new nosologies. Of course, they will concern those diseases which are priorities of the Ministry of Health, and the register, which is shortlisted to life needed drugs, and starting with 2018, Ukraine will be supplied in full with all the medicines which are dramatically needed for life of patients. Are there any more questions? You told that there are 3 medicines are lacking in the pharmacy. And what are these medicines? We have not had nystatin. And whether the prescriptions still are being written off by doctors. You mentioned this medicine which you mentioned, and also 2 other medicines they are lacking in the market, and we have already conducted and completed negotiations with pharmaceuticals, and if domestic drugs are produced, and this concerns raw materials to be imported from other countries, and if we talk about international producers, then this would mean importing these medicines and distributing in alone pharmacies around Ukraine. Production of medicines is a specific process, so to produce a medicine, the manufacturer should know the scope, how many packages of medicine it should produce. So every medicine cost much, and the scope of medicines, the output of this producer should be understandable to the same producer, because medicines, they have expiry dates. So we understand that this medicine are in high demand in Ukraine, and we can forecast what medicines which we need when we have electronic health system. Now when we lack e-health system, pharmaceutical companies, they always can be afraid, they will be at the threat of some scope of medicines not to be sold if the demand has been assessed not properly. So this electronic system will help manufacturers to work more efficiently. So far we have problems with Pharmac company, one medicine, budesonide, this is its name. No more questions. Thank you very much. That's the end of the briefing. Thank you for your attention. I would like to congratulate my colleagues with the professional holiday, and wish them every success. God bless you.